Okay, good afternoon, everyone. My name is Katrina, and thanks for joining me this afternoon for this webinar. I think we'll just get started now. I think the majority of people are here, so that's absolutely fine. So I must admit, I've actually really enjoyed researching this subject. So I do hope you enjoy this webinar as well. And if you've got any questions, I'm more than happy to answer them at the end. So throughout, if anything pops into your head, please feel free to write them in the question box and I can go through them at the end. I'm one of the service managers for Care First, so if any of the questions are sort of more of a clinical nature, I may have to get back to you on them, but that's no problem at all. I can do that via email. Okay, so let's get started. So from this webinar, I hope you'll get a little bit of information about, I'll just give you a quick overview of things and then a little information about the virus so far, preparing for what may come, coping with anxiety and fears, and the further support that Care First can provide you with. And then at the end, I'll take any questions and be happy to answer anything. So over the past few months, our entire lives have changed. And whether that's because someone might have contracted coronavirus that is close to you, or your everyday life has been halted by the lockdown caused by the coronavirus, I think there are very few people, if any at all, that have not had their lives touched in some way by this pandemic. It's been an extremely stressful time for everyone. For those who have perhaps lost their jobs, to those who are working on the front line, to those who are caring for and looking after people who are most affected by the pandemic, I imagine the majority of people have gone through so many emotions that they wouldn't know where to start describing them. From stress to worry to loneliness, even fear, and probably every other feeling in between. So when people start to talk about a second wave, mainly the press mentioning a second wave, is it all just scaremongering, or is it something we should actually be worried about? As we start to see a drop in infection rates, history does suggest that pandemics may see a surge in the near future. Normally in colder months, when conditions for viruses and low immune systems are at their peak. Every winter, we see a surge in cold and flu viruses, and coincide that with a pandemic. That could mean that there is a lot of people that become very sick in the colder months. And as we approach the end of summer, the big question will be, will it come back? Scientists are just starting to understand SARS-CoV-2 now, the strain of coronavirus responsible for COVID-19. And early studies have shown that people who have contracted the virus seem to begin to develop antibodies within about 12 days. However, questions about the strength and durability of that immune response still remain. And why is it so difficult to predict what will happen? There is still a lot of questions that remain about the virus transmission dynamics. I'm sure you're all very aware of everything that goes on in the news and hearing it is airborne, it's not airborne, you must keep 2 meters away. No, it's okay, just keep 1 meter apart. It can all be really confusing. And that's because when there is no solid evidence yet to back up what the experts are saying, different channels pick up different bits of information, and then we are bombarded with information overload. As soon as we hear one thing, it's changed again, never happened, or it's just a distant memory. At the moment, any sort of projection is really just a bit of a guess and going from our previous experience of pandemics. And in the past, the experience with influenza is that there are 2 peaks, one in the spring and one in the autumn. The big past event that people tend to look at is the flu pandemic of 1918, and how many viruses that have followed that follow similar patterns, with infection rates being seasonal and peaking in the colder months. However, not all coronaviruses included in the seasonal viruses. The COVID-19 strain of coronavirus we know is related to several of the viruses that cause the common cold. We know that the common cold strains are transmitted more readily at colder temperatures and lower humidity. hence why it is common to still get ill in the winter months. But the coronavirus strain that causes SARS and MERS outbreak do not seem to follow that typical seasonal pattern, which, as above, shows it is hard to predict what will happen with COVID-19. So, preparing for what may come. The most important thing we can do at the moment, bar finding a vaccine, and what we have been doing, is to prepare our healthcare capacity. We need to ensure that the NHS has ample supplies, enough beds, ensure that they are fully staffed, and many other things. And I'm sure you've heard our government has been preparing this since the outbreak at the beginning of the year. Along with all of this, everyone needs to prepare and take responsibility individually for their actions. Listen and understand guidelines. The best way to abide by guidelines put in place by the government is to fully understand why they have been put in place. Try not to listen to the hype in the press and on social media, and always get your information from reputable sources, for example, the government website or the NHS website. Lockdown is being lifted. However, it's been lifted in stages, and that is to ensure we remain in control. So although things seem a bit frustrating and very boring at the moment, it is also important that things are done step by step and slowly. As lockdown measures are relaxed, people are starting to interact more. And while society has so far obeyed the stringent rules, if there were to be a second wave, lockdown fatigue might make it much more difficult to impose the strict policies again. So I can't stress how important it is to listen to the experts. We will go through peaks and troughs, and they are inevitable as we start to get back to some normality. And the government won't hesitate to introduce pockets of lockdowns and restrictions, as we have seen with Leicester, to control the spread of the virus. Schools and places of work may well be put back on lockdown measures as well. As well as all of the testing and contact tracing that's taking place, it's important to learn if we can become immune to the virus. And why is that? Well, until we have a vaccine, it's another form of protection. In 2009, during the swine flu pandemic, there was initially a lot of confusion as to why older people seemed to be immune. They then discovered that the virus was actually fairly similar to the one that circulated during the 1918 pandemic. So the immune systems of the elderly had actually already built immunity to something similar 92 years earlier. However, it is currently believed that immunity for COVID-19 does not last long. It's all about keeping control of contact tracing, testing, and implementing highly effective interventions like we have been doing. Although different countries have done different things, and there have been many different success and failure stories, and we now have the experience of the first wave and are in a much better position to fight everything that comes our way. So even though the thought of a second wave can be scary and sometimes daunting, we must make sure that we do our part, and we must make sure that we listen to the experts. Remember that when we hear from the media that we haven't done things right or we have lost control, it's not strictly true. Things could have been done differently, granted, but there is nothing to say that the outcome would have been any different. We're continuously compared to countries like New Zealand, but we have to remember that they are different. Their population is different, and the spread of the population over their land is very different. It is also very easy to isolate the virus geographically in comparison to the UK. And remember, if we're going to consider all possibilities, even a small group of epidemiologists that say the pandemic would just peter out, it could already be on its way out. They argue that antibody studies are unreliable because they don't take into consideration people that are already immune to the virus due to exposure of a more benign coronavirus in the past. This view isn't common, and remember, governments will always prepare for the worst case scenario, as there is so much uncertainty. We have to accept views and information from each end of the spectrum. All we can really do is be prepared and learn from the experiences we have already had. So as a result of the unknown and multiple possibilities, fear, anxiety and uncertainty are likely to play a part in all of our futures, especially as we may be faced with more lockdowns and a recovering economy. People's lives have been completely turned upside down with bereavement, financial difficulties and much more. So it's very common for fear and anxiety to be emotional responses any of us will feel as we approach the release of lockdown. Finding a new way to pull ourselves through lockdown took a lot of our emotional energy, and we may have found a place that lets us go and that we don't want to leave it behind just yet. Many of us fear becoming ill with the virus or passing infection to loved ones, as the risk increases when people interact. Yes, there's an entirely normal response, but risk can be reduced by following guidelines set out by employers and the government. It's important to acknowledge that these feelings are reasonable and to expect them. It's only by building up tolerance gently that we can move through these fears. We might feel angry or frustrated at others' behaviours and feel the urge to rush to judgment. For many of us, the pandemic has increased our anxiety or made existing mental health issues worse. If possible, take things at your own pace. So control what can be controlled. There are a lot of things that you can't control that cause you fear and anxiety, but there are some things that you can manage or plan for. Having an action plan, what you might do if there is a second wave, is a good example. Build up tolerance to changes. Try doing something that challenges you every day or every few days. And don't beat yourself up if it doesn't go well, and keep at it. Keep a note of things you achieve, enjoy, or surprise yourself by doing. And vary your routines. Vary routines so that you see different people and encounter different situations. And how to cope with uncertainty. Most of us have been tested in ways we never imagined, have passed those tests and found new ways to manage or even flourish. For many of us, lockdown has challenged our values and what is important to us. So focus on the present, So focus on the present. You can only do your best with what you have today, with regulations changing frequently and lots of conflicting media discussions. Try to keep focus on the moment. Bring things that are certain back into focus. Whilst a lot of things are uncertain at the moment, there are also things to be hopeful about. Try to record and appreciate good things as they happen, and try to take opportunities to reset and relax. And lastly, talk to people that you trust. It is important to talk about how you feel and what is going on. Don't dismiss your concerns or judge yourself too harshly, and listen to sources that you trust. And finally, if you want to get in contact, please remember that all CareFirst counsellors are available 24 hours a day, 7 days a week, 365 days a year. They can help you with any issues you might be experiencing, whether that's due to COVID-19 or anything else that you might be going through at the moment. At CareFirst, we are completely independent from your organisation, and it is a strictly confidential service. We also have the information specialists who are on hand to help with any practical information you may need. They're available from Monday to Friday, 8 AM to 8 PM. And the contact details can be found through your organisation, or if you would like to contact me, I'm more than happy to provide the details for you. So that was my very quick presentation. But if you've got any questions, please feel free to ask, and I will do what I can to answer any of them. Thank you. Okay, so I've had one question come through about the effective tracing, and it was, do we know if we will ever see effective tracing? That is a very good question. I guess at the moment it's all kind of trial and error, and they have made some mistakes with the contact tracing, but we're also learning from countries where it has worked. So hopefully with a little bit of tweaking, it will certainly work in the future. And as far as I'm aware, they are fully expecting for it to be up and running and working. Another question that's come through is, are there examples of how you would plan for a second wave? I haven't actually got any plans to hand with me now, but I can certainly put something together. Normally a day after the webinar, you get a follow-up email, so I will add that on to the email, and hopefully that will help as well. Okay, so the questions are coming through now. I've got one. If we manage to get the virus under control now, will that make the second wave less serious? So from the research that I did, not necessarily. I mean, it should, as we should be able to control it, you know, within pockets, rather than it being a country or worldwide pandemic. From what I was reading, it really depends if the virus mutates. If it stays as it is and we are used to it and we can control it, then it shouldn't make the second wave any worse. And if there is a second wave, but if it was to mutate and become a more serious virus, then it could possibly lead to a worse outbreak. But that's all sort of based on what ifs, and again we would have to see what the experts say on that. Okay, next question is, I'm currently shielding due to go back to school in September. My school risk assessment is green. I'm a severe asthmatic and I'm coming into the rough months. What will happen if there is a second wave for people like me? I imagine for people who are shielding, and if there is a second wave, it will be again up to the government and they will tell you what is best to do. But one thing I always think is, if you're not happy doing something, then either consider not doing it, consider your options and talk to whoever you can. For things like that, September is still a couple of months away, but closer to the time, if it's still the same issue, we've got our information specialists who are available for you to phone. You can ask them the same questions and they'll be able to direct you under the government guidelines and things like that. Okay, so without a vaccine, would a second wave be followed by a third wave, etc.? Not necessarily, and it's not even certain that there will be a second wave. It completely depends on the virus. The problem is we don't know how it responds to things at the moment. You know, on one end of the spectrum, as I said in my presentation, we've got scientists who believe that perhaps it will just peter out and fade away. On the other hand, we've got scientists who think, you know, it could come back and the second wave could be worse. So it really just depends on things like herd immunity, whether that will actually work, and what the virus will actually do and if it will mutate. Okay, in previous pandemics, was social distancing ever put in place, or is this unique to COVID-19? That's a very good question. I'm not entirely sure. I remember being back at school and learning about things like the plague and stuff, and they did put local villages and things into lockdown, and perhaps not quite as strict as what we've got now. But they certainly stopped people, you know, outsiders coming in to their villages to stop the spread of it. And certainly it was a lot easier back then. Just geographically, we had much more sort of pockets and villages and small towns rather than sprawling cities and so many people everywhere. Okay, I've got another one saying, unfortunately, I cannot trust what the government say anymore. I do, however, listen to the Alternative SAGE Advisor Group and the WHO. Would these not be a more reliable source to their relative independence? Absolutely, they are who you should be listening to, and SAGE and WHO guide the government on what they say and do. So I would recommend listening to the source of the information. Okay, another question we've got is, has there been much of an increase in staff seeking counselling or information from Care First over the past few months? Absolutely, certainly within relation to COVID-19. Before the pandemic, we'd never heard of it. So obviously since the start of the pandemic, people have been wanting to talk about their emotions behind it, wanting information about it, and everything else. It's completely new to everyone. So people have been phoning and needing and wanting support, and not just the pandemic either. You know, being on lockdown can increase so many other emotions, not having routine and not being able to go into work, and you know, having to sort out childcare can trigger all sorts of other things as well. So a lot of people have been seeking advice and support with those matters as well. Okay, might COVID-19 become a yearly illness in the same way that flu is? From what I've read, it is a possibility. It is related to the virus that causes the common cold. Hopefully, if it if it does become annual, it will be nowhere near as serious as what we've got at the moment. And certainly we will have a vaccine. Some of the scientists say very soon, and some are saying by next week, but at some point there will be a vaccine, and at some point it will just become either commonplace or certainly controllable. Okay, if there is a second wave, how are the NHS going to cope with this? Are the government purchasing more PPE? And if they do find a vaccination, are there different strains of the virus? How will they be able to ensure the vaccination is complete, so covers all? Okay, so regarding the how is the NHS going to cope? Since this all began back in February, the government have been planning and preparing the NHS to be able to cope with much more influx of illness. So hopefully everything they've done in their preparation will be enough. With regards to purchasing more PPE, I'm not entirely sure, to be honest. That would be something that you would be able to find out through the government website. They've got breakdowns of what they spend all of their money on. I know they've injected a lot more money into the NHS and looking after people, so that's probably the best place to get your information for that for. And the part about if they do find a vaccination and there are different strains, will the one vaccination cover all the different strains? Again, that's a bit more scientific than I would actually know. I know that as with the common flu virus, it changes each year, the vaccination. So perhaps that would be something that comes with time. They'll develop vaccinations for each strain, but the one that I'm assuming they're developing now is for the strain that we currently have. So unless it mutates or changes, then hopefully the vaccination that they do discover and provide will cover everything. And apparently there was a lockdown in US cities during the Spanish flu. I've also had a comment, I think there will be a second wave and now worried with the news reporting bubonic plague plus new swine flu strains. I think with that, it's absolutely normal to be worried about the second wave, but all we can do is prepare ourselves. And again, like I was saying earlier, the media really enjoy sort of putting the fear into people. I read the other day that bubonic plague was back as well, and we should be starting to worry. But then I also looked into it a bit more and found out that there is actually a vaccine for the bubonic plague, and it's quite easily treatable. So hopefully, even though the press are reporting on all sorts of new things coming around, it's just going to be them trying to raise people's worries, if you know what I mean. Okay, I think I've been through all of the questions. I'm just checking. If there are any other questions that you've got, or you'd like to talk to me further about it, or if I can help with anything else, then my email is on the screen, so please do feel free to drop me an email. Okay, so I think that is it. So thank you all for listening, and have a lovely afternoon.